Robotic knee replacement is a new advancement in technology where we're able to use robotics to provide a personalized plan for each patient when they're undergoing their knee replacement. During the surgery, we map out the individual patient's anatomy, their range of motion, the angle of their knee, and we're able to make small fine-tune adjustments in the knee replacement to put the components in the appropriate position for their knee. The advantages of robotic knee replacement are that I'm able to provide a specialized plan for each individual patient. I think it requires less dissection or work underneath the skin because we're able to make small fine-tune adjustments in implant position that you can't do without the robot. And so I do think it has the potential to make the early recovery easier and to make sure that we're putting the components in the correct position for each patient, which should provide durable, long-lasting implants for many years. Robotic knee replacement is performed similarly to total knee replacement, although we put pins into the bone that allow us to register the knee anatomy with the robotic device. And then there's actually a computer screen where we can make small fine-tune adjustments and where we're going to make our bone cuts. And that's really where the magic happens with robotic knee surgery. And then there's a robotic arm that helps me to enact that plan and make very accurate cuts in order to put the implants exactly where we want them. Recovery after knee replacement is variable, and it's not a procedure that you recover from overnight. We do allow patients to weight bear right away, meaning you can walk and put full weight on the knee, but it does take time for pain and swelling to subside. Most people go to physical therapy for an average of 6 weeks, and I'd say the full recovery after knee replacement can take up to 3 months. The vast majority of our knee replacement patients go home the same day. We allow them to put full weight on the leg right away. There is some pain and swelling associated with the surgery, and that takes time to subside. And most people go to physical therapy for about 6 weeks. So knee replacement recovery is not overnight, but once patients get through that, they tend to be much better off than they were before surgery, and it can be a life-changing operation.